My name is Mathapelo. I'm a clinical nephrology technologist. I work with persons who've been diagnosed with permanent kidney disease. Let's deal with the facts. Not drinking enough water can lead to acute kidney injury. And acute kidney injury increases your chances of developing permanent kidney disease later on in life. Second fact, not drinking enough water can lead to kidney stones formation. Kidney stones formation, they're painful, okay? And they can also increase your chances of developing kidney failure, right? Not drinking enough water can lead to migraines, okay? And then if you are always constantly suffering from migraines, you're going to be given pain medication. And some people, they self-medicate and they buy the over-the-counter medication, which increases your chances of developing permanent kidney disease. Okay, next question. How much water should I drink? This is not a one-size-fits-all. It depends from persons to persons, okay? But the rule of thumb is normalize looking at the color of your urine. If your urine is light yellow, it means that you are well hydrated. If your urine is dark brown, it means that you are underhydrated. You are straining your kidneys. Your kidneys are overworking because there is not enough fluid to work with. Okay, so this means that you increase your fluid intake gradually. You're not going to drink 1 liter at a go. You're also, if you do that, you're straining your kidneys. There are people who will say, I drink 1 liter in the morning and drink 1 liter at night. No, it doesn't work like that. You are straining the kidneys because there's water. Now it works hard, and then there is no water. Now it's straining, there is no water. And then at night again, there's 1 liter straining. No, we say that steady increase. Okay, so it means that, example, wake up in the morning, you drink your 250 mils. After breakfast, 250 mils. Before going, the first thing you do when you arrive at work, 250 mils. You at work, greet everybody, opens your emails, you reply. What you do, another 250 mils. Before eating, 250 mils. After your lunchtime, 250 mils. Before leaving work, 250 mils. When you get at home, 250 mils. After supper, 250 mils. Okay, of course, you're not just gonna drink. You'll be urinating during the day, and therefore you are looking at the color of your urine, right? And we know that when your urine is clear, it means that you are overhydrating. You are drinking a lot, so therefore you are still straining the kidneys, overworking the kidneys. Okay, our kidneys, they don't want fluid spikes. Okay, they need a gradual or steady perfusion. So you're drinking water as you go gradually. That is normal, okay? That is normal, and it's good for the kidneys, and they work perfectly well, okay? Yes, and we know that when it's hot, or if it is hot and you work, your work is intense. Intense physical exercise, you are going to sweat a lot. So when you sweat a lot, it means that you have to increase your fluid as well. And not only that, but also you must replenish your electrolytes, right? And the same is true with diarrhea. You have to replenish your electrolytes. And of course, when it's cloudy, like today in Pretoria, you're not drinking enough water, which is perfectly well. The other thing is that you should not wait to be thirsty to drink water. Okay, don't wait to be thirsty. Gradually drink water as you go. And we know that there are conditions that might limit our fluid intake, but we know that we said kidney failure is classified into 5 stages, stage 1 to 3. The kidneys are working perfectly well. So here, there is no fluid restriction unless if ever doctor said otherwise. But with stage 4 and stage 5, there might be fluid restriction, especially with dialysis patients, because we know that some dialysis patients cannot urinate at all. And we do know that we have those who can urinate. And with those who can urinate, we always advise that, okay, it's always good that you measure your input and your output in 24 hours. Of course, this is not, it's not like, it's not accurate, because we know that your pap and your rice, they have water, right? And also when we do number 2, the stool has water. Otherwise, if there's no water in the stool, you are constipated problems, right? And we know that we always say that a compliant dialysis patient does not gain more than 2.5 liters. All right, so please, if you're gaining more, that is not right, because then you're straining the heart. You know, heart enlargement, left ventricular hypertrophy. Heart is a muscle. If it stretches, it doesn't go back. So these are complications. And speaking of the heart, we do know that at the dialysis unit, we do have those cardiac failure patients who come for dialysis just to remove the fluid. So here we're only ultrafiltrating, and there is no cleaning of the blood. So your pump speed would be 250 mils per minute or less, and your QD dialysate flow will be as low as 0. Some machine can allow, and some machine can only go as low as 300 and 400 mils per hour. So we're saying that, yeah, fluid, heart failure, there is fluid balance. It's delicate, right? So yeah. And with kidney stones, again, kidney stone, they need higher fluid intake. Okay, so I said higher fluid intake. How much you have to take? You have to engage with your doctor. He will give you, he or she must give you answers. He is your doctor. He is obliged to answer your question. It is your right to ask these questions and get the answers. Okay, so yes, and we know that there are people who say, no, I urinate at night, I wake up at night to urinate several times. There's a medical term for it. It's called nocturia, right? And what it does, it interrupts your sleep. You don't rest well, okay? And the body also don't rest well, and it is not able to heal itself, okay? All right? So we're saying that stop drinking and water an hour or 2 hours before bedtime. So in this way, you will be able to sleep peacefully, okay? And remember, kidney failure awareness saves lives, and follow for more kidney health education.